we are going to review the function of the muscles called depressor Anguli Oris, which depresses the angle of the mouth and contributes to the formation of the marionette lines and the downturn of the corners of the lips. We have already injected in the glabella area and also the nasalis for the bunny lines. As you can see, there's some redness in those areas. Now we're going to inject the depressor Anguli Oris, DAO, for the marionette area. We have you make the frowns with your lips. So these are the muscles that actually contribute to that. And you notice that many people, as they age, get the downturn of the lower lip, which is extremely difficult to correct with surgery. But the placement of the Botox is very important in this muscle because there are other muscles in the surrounding area that if we inject that, it will give an extremely unnatural look to the lower lip. So the location of the muscle is insertion to the skin is up here, so we go very superficial and inject that area with Botox. And as you know, Botox is not a filler. What it does, it makes the muscles weak for a temporary time by blocking the transmission of the impulse from the nerves to the muscle. And that time is about 3 months on the average. Once again, placement in the depressor Anguli Oris. This may be done differently by different injectors. And once we see a little bit of a bleeding, pressure is held, avoided the bruise. Areas injected are in the depressor Anguli Oris, superficially. The amount used is very small with Botox. And it would take about 7 days for this to take effect. Initially, if patients have never had this before, they feel as though their corners of their lips are going up because the muscle is not pulling that down anymore, but actually they get used to the sensation. And the satisfaction is remarkable, and it does a great job with preventing these from getting worse.